Good morning. Okay, going to start our program today. Let me do a little testing. Test, test, test. Testing, testing. Let's see. Yeah, perfect. So we're all connected now. And thank you. I have a few seconds so I can look at the screen. Oh yeah. Hi, Abha. I see Abha has just joined. She's watching. Okay. Today's topic, Abha, is again a request, so you might like it. So today is Saturday. It's September 2nd, 2023. This is our regular yoga therapy class. And as you know, we used to do it in person before. And after pandemic, we switched it to virtual. Initially started in Zoom, now in Facebook Live. And we are picking up requests this year. And we have done most of the requests, but a few weeks back we got a request from another a famous yoga therapy practitioner. She wanted to know more about diabetes. We talked about diabetes as a part of our metabolic syndrome. So what I'm going to do now is giving you the concept, what we call pathophysiology. Pathophysiology means the physiology behind it and the pathology. Physiology is the normal body function. Pathology is the normal function, and yoga therapy and our modern medicine is a therapy to convert pathology to a physiology. Now, diabetes, oh my gosh, we call it a mother of all the diseases. Look at the number of people who have a diabetes today. And let's find out what is the true underlying cause of diabetes from yoga therapy perspective and how we can take care of it. From Western concept, yes, insulin resistance, problem with the receptors, problem with the insulin not working, not enough insulin, whatever. You know all about it. I don't have to talk about it. But let's find out what is the root cause and conceptually what we can do from yoga therapy standpoint. First, our observation as a Western trained physician. If we give a patient a little bit of prednisone, you all heard about the medication called prednisone. Prednisone is a steroid. Prednisone, blood sugar will jump way higher. From 100 milligram to 400 milligram, boom, right away. Effect of prednisone. Guess what? The hormone of our stress is the cortisol. Cortisol is the steroid. All the diabetes you are seeing today is due to this fright and flight response, or what we call a stress, what we call a high sympathetic overdrive, creating the high cortisol level, and the cortisol is converting our fat or the sugar to a omental fat. Omental fat is the fat which is inside our abdomen. So when you see the truncal obesity, this is the first sign of metabolic syndrome and diabetes. This is the first thing. The omental fat is inside your abdomen. It secretes pro-inflammatory molecule, adiponectin, a lot of other things, lipoxygenase, but the pro-inflammatory molecule starts the inflammatory process, which starts the cascade of diseases, diabetes, hypertension. We call it a dyslipidemic atherosclerosis. Atherogenosis means blockage of the arteries due to a plaque, or the coronary arteries or peripheral arteries. Dyslipidemia, abnormal lipid, primarily is high total cholesterol or normal total cholesterol with a low HDL, which is a good cholesterol, and a high triglyceride. High LDL, low density lipoprotein, is also responsible. So putting all this thing together, truncal obesity, diabetes, hypertension, atherosclerotic heart disease, coronary artery disease, dyslipidemia. Now also comes we also include depression, we also include insomnia, sleep apnea. These are all the root cause of this issue. So the primary therapy for diabetes will be the taming, the quieting down, taming of the limbic system. Activation of the limbic system is the outcome of your fight and flight response. It mediates through a center in the brain called amygdala and a hippocampus. There's a limbic system. Sends a signal to through neurotransmitters, through hypothalamus. Hypothalamus sends a signal to neurotransmitter to pituitary gland, pituitary adrenal axis, increasing cortisol, and also the autonomic nervous system to increase the sympathetic overdrive. So quieting down, relaxation response, activation of the parasympathetic tone. Parasympathetic tone is mediated in our body through a vagal nerve called vagal tone. Vagus nerve has an 80% afferent. That means signal is going to a brainstem, 20% is efferent, 20% is coming out. So we'll show you the practices how to activate the vagal tone, starting with the auricular branch of the vagus nerve, nasal breathing, activation of the pharyngeal and cricothyroid plexuses, your activation of the superior inferior laryngeal nerve through ujjayi pranayama, through your cardiac plexus and pulmonary plexus, through a breath holding inhalation called Herring-Brewer reflex, activation of the vagus nerve in the abdomen through slow Bastrika pranayama. So first concept is quieting down, taming of your limbic system through vagal activation. Second yogic concept or Ayurvedic concept is high blood sugar. Body cannot digest sugar. It's your low body digestive fire, which in Ayurveda call a Jathar Agni. Agni is your digestive fire, Jathar is your stomach. The whole concept of diabetes is called Manda Agni. Your Agni, the digestive fire, is low. Manda Agni increase Ama. Ama is your toxic substance of your improper digestion, and low Ojas. Ojas is your immune system. So when you take a food The food with the proper digestion. In yoga and Ayurveda, digestion is through your 5 senses. It is your 6 taste, 7 coloring fruits and vegetables, which I described a lot of times, but we'll do it again one more time. Yoga therapy for your digestion or nutrition. So it converts into 7 tissues called saptadhatu. Rashadhatu, Raktadhatu, Mangshodhatu, Medodhatu, Ostidhatu, Majjadhatu, Shukradhatu. 7 tissues that it converts into your substance called ojas. In diabetes, your Agni is low, food is not properly digested, so you get a toxin called Ama. Ama then blocks your nadis, the channel. Prana cannot flow properly, and you get the concept of diabetes. Remember, very important, low Agni, Manda Agni, increase Ama and low ojas. Third concept, pancreas is sitting in the almost close to your vertebral body, in abdomen, way behind, almost to the back of your abdomen. So all the asanas, which includes your spinal twisting and movement of your spine, affects your pancreas. So in a reductionist Western medical mindset, that those asanas squeezes the pancreas, massages the pancreas, and squeezes the insulin out. Also in yoga, if you massage an organ, that organ become more functional. So asanas like, say, spinal twist, Vakrasana, spinal, Ardha Matsyendrasana, Yog Mudra, say Paschimuttanasana. I will demonstrate and show you all of them, so you will be able to see and you will be able to incorporate in your daily practice. Also, very, very important concept is that when you are in an asana pose with a spinal twist, you stay in the asana a little longer and longer and longer. So what happens? Asana goes through stages. The first stage of asana is called arambha, beginning. You start the asana. Muscle cannot stay contracted that long. Muscle has to start relaxing. Before relaxing, it causes little fasciculation, twitching. Then it quiets down. It's called sthiti, stability. Then it's called visarjan. Visarjan is your surrender, profound relaxation response, and the taming of the limbic system. So what happens in an asana for staying for a longer time, you develop an asana called a sthiram sukham asana. Stillness and happiness in an asana. Your breathing gets completely effortless, called the voluntary regulated breathing or pranayama. You enter slowly into the 5th limb, it's called pratyahara, controlling of the senses. 6th limb is called dharan, the focus. 7th limb is a meditation or dhyan. Able to sit down in the asana, you enter into a state of meditation, and meditation is your medication. So state of meditation is a therapy for your diabetes. And also for the Agni, we'll show it to you. You will do your call, the asanas, 5 asanas to ignite your Jathar Agni, the stomach Agni, and asanas like a Vajrasana, thunderbolt, that increases your parasympathetic output. And whole digestion From our mouth to the anal canal, whole digestive tract is supplied by parasympathetic nerve. When you are in a relaxation phase, you have a saliva in your mouth because the parasympathetic nerves are going to cause your wetness, saliva in your mouth. Dry mouth is a sign of a sympathetic response. When you get a fear, you get a dry mouth. So my mouth is wet. I'm talking to you, my mouth is wet. So the first practices will be taming of the limbic system. So this is the difference between a Western medical concept and a yoga therapy concept. Western medical concept is a reductionist. I'm an endocrinologist, I'm a pulmonologist, I'm a cardiologist. I'm looking at the organ from the organ standpoint, from the pancreas, from the insulin, from the receptors, insulin resistance, all this stuff. Yoga therapy says, quiet down your mind. Get your cortisol level down, your blood sugar will come down. Increase your digestive fire. Sugar will be digested, sugar will be high. First practice. What is relaxation practice? Relaxation practice is called Merudanda Achal and Manasthir. Merudanda Achal means keeping your spine straight. My skeleton is going to fall down in the front if there is no muscle. I have a muscles in the back called paraspinal muscles. They're always in a state of contraction to keep me upright and straight. If I keep my spine straight, I give a relaxation these muscles. I slowly bring a relaxation response. Here I am sitting in my kneeling stool. You sit in a chair, do the same thing. I have the special chair, all of you have seen. I have a three-legged chair for doing yoga. So, sit down. Quieting down your mind. In yoga therapy, mind is the content of your five senses. I hear, I see, I smell, I taste and touch. So what do? You need to tame your five senses. Best way of taming your five senses is called Brahmari Pranayama, bumblebee breathing. Best way to tame your senses, close your eyes. Because eye is an extension of your brain. Eye is the brain which is not covered by your skull. Closing your eyes, you're going down to your mind. Any input, called prata ahar, ahar means your input. Any input through your eyes, through your ear, or smell, taste and touch, shabda, sparsha, roop, ras, gandha, Sanskrit term for the five senses, write it down. Hand connects your body and mind. Hand moves before your mind. If I find something good, I say this. If I want something, I say this. Before I can even talk. So hand mudras, hand gestures. Touching tip over index and finger is called a dhanu mudra or ganu mudra. Put it over your knees. Breath. Breath is a connector between your body and mind. Lung is like a balloon. It has 6-liter capacity. It needs 1.5 liter to keep it open. A 4.5 liter to exchange, called vital capacity. We only exchange only 500 cc. Exhalation is parasympathetic, inhalation is sympathetic. Learn how to breathe out first. Take a slow deep breath in, completely effortlessly. Breathe out longer than breathing in effortlessly. keep doing it. Slowly you will develop a neuroplasticity. You'll be doing longer and longer. There is nothing called deep breathing. A rate of respiration will slow down. If you can just do 2 seconds in and 4 seconds out, 6 seconds, your breathing rate will come down to 10. Normal breathing rate is now 15 to 16 a minute. You can easily do 3 seconds in, 6 seconds out. Almost 9 seconds a cycle. 6 or 7 breaths a minute. Slowly your whole mind quiets down. If you use a health tracker, this is a health tracker, we do it all the time, you will be able to see your heart rate is coming down, your blood pressure is coming down. Even few of the trackers are going to give you your blood sugar. Blood sugar, your sleep, your amount of deep sleep, all comes in your health tracker these days. Sitting in a chair, a relaxation, a powerful relaxation is your adhimudra. Like baby fist, baby puts a thumb inside and close. The moment you do this, the moment you do able to do the adhimudra, your hand gets relaxed. Hand gets relaxed, your fingers are got separated. Hand moves just in and out. So these are the signs of relaxation. Before is very tight. Wrist gets relaxed and extension. And do the breathing. Breathe out first, breathe in, breathe out. Or prayer pose to the back, Paschim Namaskar. You have seen me doing so many times, hands in the back, slowly turn it around as a prayer pose and just do a very simple prayer pose to the back. It slowly relaxes all the muscles of respiration. And you're able to sit down or stand up, and this is your normal position. This is D-I-S space E-A-S-E. This is. Treatment of this is an effortless ease. Mind should be in a state of effortless ease, and here with this asana, Paschim Namaskar or prayer pose to the back, I'm slowly entering from my Arambha, beginning, to Sthiti, stability, to Visarjan, the total relaxation response, entering into a state of meditation. You can use the bumblebee breathing, the Brahmri Pranayam with the neck movement. I've shown you all these things. These are our regular practice. The first quieting down of your mind, quieting down of your vagal tongue. Control all of your 5 senses, create a vibration. The brain has a vibration, 2 vibration interacts, cancels, is called your harmonic rhythms. Index finger in your third eye, you can use a Shanmukhi mudra or also use the 3 fingers to close your eyes, use your thumb to close your ears. You breathe out first, then you will breathe in and breathe out with the sound of a bumblebee. This follows with the pumping and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth of your hand, if you're wearing glasses, remove your glasses, take the hands like a cup, put it over your eyes, and let the eyes take all the heat from your hand. The heat will relax all the muscles of the eyes. It will relax your ciliary muscles. Ciliary muscles tightens your lens. When the ciliary muscle is relaxed, the lens gets more convex. It almost acts like you're reading glasses. It also relaxes the muscles inside the eyes. Eyes is supplied by the 4 cranial nerve, SO4, LR6. Superior oblique muscle supplied by the 4th cranial nerve. Lateral rectus muscle is supplied by the 6th cranial nerve. Retina in the eye is supplied by the optic nerve. Surrounding part of the eyes is supplied by the trigeminal nerve. These are all cranial nerves. Your brain stem starts to get relaxed. Slowly massage all the forehead. The muscles here are attached to your skin, so the muscles are relaxed. All the frowning will go away. All your lines are slowly going to go away. Massage your face. When you do that, people will say, looks your skin looks like you are glowing. Slowly massage your earlobe. Behind your ear, in front of your ear, inside the ear canal, external ear canal. It's a branch of the vagus nerve called the auricular branch of the vagus nerve. Vagus nerve gives a sensation of relaxation, calm and digest. And you have seen, if you take a little bit of a Q-tip and just a little tickle inside the external auditory canal, you'll feel the calmness and relaxation. Bring your hands, slowly massage your carotid sinuses. This carotid sinuses quiets down your cardiovascular system and the nervous system. We use the carotid sinus massage for your supraventricular tachycardia. Take the hand behind, massage the occipital tubercle behind. There are 2 muscles, trapezius and sternomastoid muscles. Both are supplied by cranial nerve. These are activation of your vagal tone. Polyvagal theory. You'll hear it more and more in the whole yoga therapy concept now. Nasal breathing. Do not breathe through your mouth. God gave us the mouth to talk and eat. Always breathe through your nose, both inhalation and exhalation. If you have to breathe through your mouth, you can always breathe out, exhalation. That is more physiological. But what happens, we have a muscles of inspiration for inhalation, muscles of expiration. If you start doing the mouth breathing, you lose the function of the muscles of expiration. And when you do the nasal breathing, so you breathe out first, slowly take a deep breath through your nostril. Air is entering through your nose. Air is getting filtered. Your nose is a powerful filter. Your nose is your personal air conditioner. If outside air is warm, it will cool it down. If outside air is cool, it will warm it up. Air goes to the side of your nostril, called the turbinate. It generates a vortex. The vortex goes over the mucosa of your sinuses. Mucosa of the sinuses releases a substance called nitric oxide. Nasal breathing increases nitric oxide. You can look at all the literatures. You can go to PubMed. Put it down. Nitric oxide and nasal breathing. You'll see so many articles will come up. Nitric oxide is a powerful vasodilator. It opens up all the blood vessels, relaxes the blood vessels. Nitric oxide is a mediator of your parasympathetic tone. Parasympathetic tone is mediated through acetylcholine, nitric oxide, cyclic GMP. Air will enter through your nostril, behind your throat, upper part of the lung, middle part of the lung, lower part of the lung. When you take a deep breath in, hold your breath. Breath holding in inhalation. Breath holding in inhalation, slowly expand your lung. Your lung, the air is not coming out, but air is getting exchanged. Slowly and slowly, lung comes to the point up to your rib cage. Cannot expand anymore. A reflex comes in called Herring-Brewer reflex, which is the activation of the parasympathetic tone, activation of the vagus nerve. Lung slowly tries to adapt. But be sure you hold the breath only up to your effortless ease. Don't make any effort. So you're all talking about a vagal activation for blood sugar to come down, because of the cortisol level will come down. Then you incorporate a chin lock called Jalandhar Bandha. A chin lock, bringing the chin towards your chest. It massages the carotid sinuses. So the Brahmari Pranayam, bumblebee breathing. Now, breath holding in inhalation, called Abhantarin Kumbhak. What do you call it? Retention. Inhalation, Puraka. Breath holding in inhalation, Abhantarin Kumbhak. Exhalation is Rechak. Breath holding in exhalation is called your suspension. Breath holding in inhalation with a chin lock, we call it a Murcha Pranayam. Murcha means you are almost like unconscious. It is so relaxing, so powerful tool that it literally reduces your cortisol level. Brahmari Pranayam, Murcha Pranayam. Cannot be any better practice than this to reduce your blood sugar. It is not massaging the pancreas. It is the cortisol which is increasing your blood sugar. Technique is, let me do it one time. You say it and you will be able to do it yourself a few times. Breathe out first. Take a deep breath in. Hold your breath. Slowly bring your chin down towards your chest. Keep counting. 1 and 2 and 3 seconds. See how long you can stay without any effort. If I have a blood sugar monitor today, which you can put, you're bound to your blood sugar is going to come down. Pranabhu pranayam. Pranabhu pranayam is basically your chanting pranayam. Same concept. You create a vibration, brain has a vibration, two vibration interacts, cancels. Purely harmonic resonance. Om sound has the same frequency as your brain sounds. Om has a 3 component, A, U, Ma. We use 3 mudras. This is touching your index finger and thumb, putting your palm high up. We call it a Dhana mudra or a Jnana mudra, meditation mudra. When you put your hands down, it's called your chin mudra. It opens lower part of your lung. If you close your fingers, this is called a Chinmay mudra. It opens the middle part of your lung. And when you do your Balo Mushti mudra, like a baby fist, or called Adhi mudra, putting your thumb inside and close, it opens the upper part of your lung. So you do the A, U, Ma with 3 mudras. The first is your chin mudra. Touch your hand, put your hand down in your knees. It will be A. Breathe out first. Take a deep breath in. Chinmay mudra, U. It opens the middle part of the lung. Breathe out first. Adhi mudra, a Bala Mushti mudra, it opens the upper part of the lung, and sound is Ma, A, U, Ma. Breathe out first. follows with your pumping and cupping, which I showed at the beginning. The reason for doing this is the person who comes with diabetes with you, most of them have a truncal obesity, most of them are a little obese, and most of them has never done a practice of yoga. And if you put them in an asana, if you put them in a chair or even, and they're not going to be compliant, So in a primary thing in yoga therapy, you start with the patient where they are. Bhramri pranayam. Let's recap it. Bhramri pranayam. Murcha pranayam. Pranobho pranayam. Pumping and cupping with activation of your auricular branch of the vagus nerve, massaging carotid sinuses, activation, and you're controlling the brainstem through your branches of your cranial nerve. Nasal breathing to increase the nitric oxide as a vasodilator, because endothelial health is your present day health. Pharyngeal and cricopharyngeal plexuses are your stimulation of the plexuses through your called corno-rogantor pranayam. Corno is your ear opening pranayam, or you call it Valsalva maneuver. You will be breathing out first. Take a deep breath in, and you will start to blow out with your closing your nose and mouth to open your eustachian tube. This happens when you're in a plane. You're in a plane, when the plane starts to get up or down, you get a blockage in the eustachian tube and you get a very painful eardrum. Open them up. So breathe out first. Take a deep breath in. Blow it out against the resistance. It's almost like it's trying to bear down when you have a problem with little constipation. You don't have any proper bowel movement. See, people think, I'm pushing it down. You cannot push down the anal canal and rectum from here. But when you start bearing it down, you're activating the vagal tone, and the vagus nerve supplies the rectum and the anal canal. It starts contracting and trying to get your feces out. Activation of your vagus nerve to the branches of your laryngeal nerve. Larynx is supplied by superior and inferior laryngeal nerve. Also through a recurrent laryngeal nerve. Recurrent laryngeal nerve on the right side comes from the vagus nerve underneath the subclavian artery and comes to the right side. In the left side, it goes underneath your aortic arch and comes up to your larynx. So, when you slowly constrict the laryngeal muscles and start doing a breathing against inhalation with a resistance called Ujjayi pranayam or a victorious pranayam, the input goes through vagus to brain stem, and output comes out through a glossopharyngeal nerve and a hypoglossal nerve. Glossopharyngeal nerve supplies your soft palate, palatoglossus and palatopharyngeus. So your snoring goes away, and your sleep apnea goes away because the tongue goes in the front. Sleep apnea is one of the root cause of your diabetes and metabolic syndrome, because sleep apnea is a fear, underlying fear. You cannot breathe and you wake up. The fear stimulates your limbic system, causing increase in cortisol production. So slowly you'll be doing, start your index finger and thumb with your thumb. You'll breathe out first. Slowly take a deep breath in, then completely breathe out, and trying to breathe in against a resistance. If you get a cough, it's a very good sign, because cough comes from your larynx. That means you are tightening the larynx, activating the superior inferior laryngeal nerve. This is a therapy for sleep apnea. It's a therapy for your diabetes, because sleep apnea is one of the root cause for your diabetes. So we are going to the root of the disease. We are not symptomatic, we are not reductionist. Cardiac plexus and your pulmonary, all the branches of the vagus nerve gets activated when you do the breath holding and inhalation with the chin lock, called your Murcha Pranayama. The vagus nerve comes. The right one goes behind the gastroesophageal junction, the left one goes in front of the gastroesophageal junction, then it distributes in the whole gastrointestinal system. So a very slow Kapalbhati Pranayama. Slow Kapalbhati Pranayama will stimulate your branches of the vagus nerve. So sit down, with a Adi Mudra is very good relaxation. Very gentle, 1 per second Kapalbhati Pranayama. Kapalbhati Pranayama is a therapy for your diabetes. It is your Agni Deepana. It is a Agni Pradhan Pranayama. It massages all the internal organs. It massages your stomach, massages your liver, massages your spleen, massages your pancreas, massages all the intestinal contents. Ignites your Agni, Jathar Agni. There is a balloon here, the diaphragm here, balloon here. Push that belly button in and do the Kapalbhati Pranayama. Kapal means forehead, Bhati is the shining. You have seen all this in my pranayama practice. Kapalbhati Pranayama is followed by your udyani bandh and Agni Sarkriya. So, sitting in a chair, in udyani bandh, what you will do, you will be breath holding in exhalation. So breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach in and hold. These are almost a money back guarantee for the treatment of your diabetes. Agnis are clear because these are a relaxation response. You won't be able to do it unless you're relaxed. Plus it's massaging your pancreas, massaging all the intra-abdominal organs. Same thing, breathe out first, suck the stomach in, then move the abdominal wall to massage. Agnis are clear. Breathe out first. Deep breath in. Completely breathe out. Every time I activate my larynx, I get a little cough. That tells you that your pranayama practice is perfect. That is, it's affecting organs. Pranayama. Prana, yam. Prana is a life force. Yam, control, strength. Savasana, your relaxation techniques, instant relaxation technique, quick relaxation technique, your So if you come to me and you said, I want to do only one asana for your diabetes, which one should I do? So what will be your answer? What is the blood sugar for? Food is not getting digested. What is the first asana for digestion? Vajrasana, thunderbolt. Vajrasana is the only asana we do with your full stomach. Because Vajrasana activates your parasympathetic tone, it activates your vagal tone. Because it keeps your spine straight, keeps your head straight high up. So, able to sit down in the Vajrasana, and I have seen most of the yogis after they have their big meal. They have lunch or a dinner. After that, you'll sit down in a Vajrasana. And many people say, you know, it's a little bothering me. Okay? If it bothers you a little bit, you can do two things. One, you can roll your mat. If you can do with a roll mat, you can put the roll under your ankle like this, and then you'll be able to sit down slowly. And then don't push yourself. Try where you are. Even if you have to put more, put in a folded blanket. In a folded blanket, what happens when neuroplasticity sets in, you'll be able to take them out slowly, one layer at a time. Then if you have a problem in sitting, then what you can do, you can take and put it in between. And once you're able to sit down in a Vajrasana for a while, it is going to activate your vagal tone. You can do a Mundukasana. Take your hand, it's like your Adhimudra, put at level of your belly button, and again, effortless breathing. Breathe out first. Slowly take a deep breath in. Completely breathe out. And a normal breathing, slowly start coming down. Listen to your body's signal. There will be no pain. There will be effortless breathing. And wherever you can come down, you stay here and do your breathing out longer than breathing in. Stay here 5 to 10 breaths and slowly come down. Slowly come up. Mundukasana. Very, very important asana for your diabetes. Vajrasana, Mundukasana. Yog Mudra, Paschimottanasana. You know, so when you do a Paschimottanasana, people say, you know, my back, I do it from my back. When you do a Paschimottanasana, seated forward bend, you will see the muscles tightening takes place here in the rectus muscle. It is all here. So if you start wherever your hand comes, if hand comes here, and slowly, remember, it is your body signal. You are not competing with anybody. Listen, no pain, effortless breathing. You are coming down to the point that you can't even clasp your hand. Yes. If you're doing with me, you will feel it in your abdominal wall muscles or rectus muscles. And able to stay 5 to 10 breaths. Because of the lack of time, I'm just showing you how to do them. Your mudra, you can do your lotus pose, Padmasana, and do a Yog Mudra in your Padmasana. So able to touch your forehead in the ground and able to activate your. But longer and longer you stay. So when I practice, I stay this one for a long time. Your mudra. Spinal twist. Very, very important. And you also do both sides equally. You know, you separate your toes. We do this routinely as relaxation. No, relax your ankles. Relax your whole lower part of your body. Vakrasana. We think it is massaging your pancreas. It is, no question about it, but it also going to the state of your, the last stage of the asana, visarjana, and entering into state of meditation. We practice all the time with our eyes closed and practice with our health tracker so you can see what is going on. Right foot comes next to your left thigh, left hand goes outside your right knee, right hand goes to the back, left hand touches your left knee. Look straight. Breathe completely effortlessly, breathing out longer than breathing in. Slowly twist your body and stay here. Initially, the reductionist approach of massaging the pancreas, and essentially it ends up with your taming the limbic system, controlling or reducing your cortisol level. Love your body part, hold on to it, grab it, breathe in and out. Wonderful practice. Same thing now, left foot next to your right thigh. Right hand goes as the left knee comes down, touches your knee, go to the back. So, again, recalling back, Vajrasana, Bandhukasana. Paschimottanasana, forward bend, spinal twist, Vakrasana, Ardha Matsyendrayanasana. So, all the research is being done, Ardha Matsyendrayanasana. It is no question about massaging your pancreas, but at the end is your sit down is called Vaisasana. Vaisa means your buffalo. Buffalo cows, they sit down like this. From here you can do a cow face, Gomukhasana. Right is that? You put right hand up, left hand up, put it there, touch it, hook it, and you'll be sitting here for a long time. This is a profound relaxation. Relaxation of the upper part of the body and the lower part of the body. profound relaxation, activation of parasympathetic tone, treatment of diabetes. A question ask. Right foot comes next to your left knee. Left arm comes outside your right knee. Right hand goes to the back. Slowly comes your knee, comes to your leg, to your feet. Breathe in and out. Slowly turn your body, and you will see when you turn, at a certain point, you feel the effort in breathing. What is an effortless breathing is that you are able to talk, you are able to sing in the practice. This is one of these classic asana for diabetes. Also, Matsyendranasan, there is no English translation. In English translation it says, have Lord of the Fish pose, which doesn't mean anything. And essentially at the end it is your Manda Agni. Low Agni, you have a digestive fire and they're not able to digest your sugar. And all the asanas you can think of, you can think about a Sarvangasana, the shoulder stand, plow, halasana. These are all having what is called your udarkarshan, massaging your abdomen. You can do the 5 asanas for your Shankha Prakshalan. Shankha Prakshalan is your intestinal cleansing. I've shown you enough. If not, you can go to my YouTube channel. You can see 5 asanas for your Shankha Prakshalan. And one of the asanas is called Udarkarshanasana, massaging your abdomen. Now, it's opposite on the balancing both sides. Left foot goes against your right knee. Right hand will go outside your left knee. Left hand goes to the back. First touches the knee and slowly goes to your ankle. Same phenomena. Breathing out first. Slow deep breathe in. Exhalation longer than inhalation. At least 5 to 10 breaths in this position. Let's finish our practice today with the 5 asanas for your activation of your Jathar Agni, igniting digestive fire. This is also regarded in your yogic tradition centering the umbilicus. Your belly button has to be centered. And you have a lot of ways to find if the belly button is centered. When the belly button is centered, your digestive fire is active. So you lay down slowly. Feet separated to the width of your mat. Your chin is little below. For practical purposes, chin should be below your forehead, but at least instead, if it is high up there, you put something under your head. Head is about around 6 inches from your body, palm facing high up. If it's a baby, baby will have abdominal breathing. Breathe in belly up, breathe out, goes in. This is your abdominal breathing. Abdominal breathing is a parasympathetic activation. Children are most relaxed and most flexible. Children will sleep with their feet together like this. This is called Supta Baddha Konasana. Take a look at the infant. They will look the hand, thumb inside and close, Adhi Mudra and Supta Baddha Konasana. This will put you to sleep. Sign of health. Strong digestion, easy elimination, good night's sleep. So asanas to activate your Jathar Agni. First, fit raising, Utthita Padasana. From there you go to your Nokasana, boat pose. You have to hold it for a longer time. I'm showing you the technique. From here, you go to your Pavan Mukta Asana, knee chest. From knee chest, you go to your Setubandh Sarvangasana, bridge pose. You have 3, this is 4, and then the last one will be your Padamashtikasana. Setubandh Sarvanga Asana. Touch your back of your heel, slowly put your body way high up, like a bridge pose. When you're comfortable in a bridge pose, and stay, see if you can get into 1 foot, 1 footed bridge. And down, the other one. When you're practicing for holding for a longer time, at least 5 to 10 breaths. Then we'll get into a sleep. I have a lot of videos, yoga therapy for insomnia and sleep apnea. Once you sleep well, blood sugar comes down. As simple as it is. Hold on to your right foot, bring it up, slowly touch it to your forehead. Padamashtikasana ignites your Jathar Agni. The other one too, opposite side. Finally, you can do both. Bring it up as much as close as possible and touch it to your foot. Turn it around. But if we do a whole sleep, we sleep like a. There are 2 ways of sleeping. Sleep like a baby, sleep like a yogi. Yogi sleep with your left side, with your fetal position. So, yoga therapy for diabetes. Take home 3 concepts. Quieting down your limbic system to reduce the level of cortisol. Activation of the vagus nerve, increasing vagal tone. Also to quiet down your limbic system, but increasing the digestive function, because the whole gastrointestinal tract is supplied by your parasympathetic nerve. Finally, the asanas to massage your pancreas, and asanas to bring a profound relaxation level of your Visharja. Another concept is that it's a scenario, a person who is dying. The last breath comes out, so they expire. When the lung stops, then the heart stops. Lung and heart is the same organ in yoga. In Western medicine, yeah, I'm a pulmonologist, I'm a cardiologist, but for yoga, heart and lung is the same organ. When lung stops, the heart stops. When the heart stops, the brain stops. When the brain stops, all the cellular function stops. So if you improve the function of your lung through a Bhastrika pranayama, bellows, Kapalbhati pranayama, Anulom Vilom pranayama, alternate nostril breathing, when you improve the lung function, improve the heart function. Improve the heart function, if you improve the brain function. Improve the brain function, you improve the cellular function. So improve the function of the beta cells, which is in the pancreas, which is a cellular level, and the beta cell functions gets better. Your receptor site gets better. Receptor site functions better. So in a daily pranayama practice, you do Bhastrika pranayama, Kapalbhati pranayama, Anulom Vilom pranayama. Basic 3 pranayama. Then you add your Brahmri pranayam for diabetes, your Mursha pranayam for diabetes, Pranabhav pranayam your diabetes, Ujjayi pranayam for your diabetes. Thank you. If you let me talk about diabetes, I'll be talking for the whole day. So it's a time to finish. It's already over our scheduled time. We're cutting it down to an hour and 15 minutes. And for the sign of health, able to sit down on the ground and oh my God, now easily you can get up without a support. Thank you again for joining us, and if you send your request, I will try to fulfill your request. One request I know already came is your thyroid diseases, yoga therapy for your thyroid diseases. If I'm in town, I'll do it, take care of it. If you have any comments, questions, please write it to Facebook. I don't know when I'll be able to return your call because I don't go to Facebook that much except this your live presentation. This will be already up to your YouTube, so you'll be able to go to my YouTube channel, able to see. Okay, see you next Saturday. Bye-bye.